Hi guys, how are you doing today? My name is Zeeshan. I am the CEO and founder of YouYaa, and today we've got another exciting episode of The Successful CEO. Today we are speaking to someone very, very special, someone who I've known before and we've worked together. Anca. Hi Anca.
Hi, thank you so much for having me.
How are you doing today?
Great.
Good stuff. So obviously we know each other from before, but everyone else doesn't know who you are. Why don't you tell us, everyone, a little bit about yourself, what you do, and your company, 23 Consulting?
Sure. So I'm the co-founder of 23 Consulting, which is a company that's based in Paris. And we focus on supporting healthcare organizations with their blockchain projects. So basically what we do is that we try to identify very specific pain points that companies face. And then we try to see if blockchain can solve any of those pain points.
Right.
And if blockchain is the more efficient and effective, because blockchain is never the only way to solve a problem, but if it's the more efficient and effective one, then we develop pilot projects and we help the companies implement the technology.
Wow, that sounds like a particularly large project for every single client you've possibly ever had, right?
Yeah, it's very interesting projects. Usually it depends. It can go from a couple of weeks to identify the need to a couple of months if we have to build a project. But we're very, very lucky to work with some great companies, whether it is pharma companies or NGOs or startups. And it's a lot of interesting projects that can help the healthcare community, can help the patient. And at the end of the day, this is what we're looking for.
Right, I see. I mean, are you allowed to talk about any of the projects that you've completed?
I can give you wide examples of some of the use cases we've worked on. So one of the use cases that's very special to us is everything that has to do with the way you optimize a clinical trial. So when you try to put a product on the market, a pharma company needs to do a clinical trial, which proves that the drug is safe to use and has a good positive effect on the health outcomes. And this clinical trial can cost up to $2 billion for a pharma company. Wow. And it usually takes up to 15 years to get to market. So time to market is incredibly high and the cost to market is super high as well. So we're looking at this process and it's really such a shame for patients that they have to wait 15 years to get a treatment, right? So we're looking at how can we speed up this process and how can we make it more efficient by using new technologies, whether it's blockchain or something else. We're just trying to assess if blockchain can have an impact on this. Can we put this product on the market faster and less expensive? Right. So this is some of the things that we're looking at.
Amazing. That's really impressive. And I suppose my first question to you would be then, how did you get into that? Like, where did you come from? Like, what's your background and how did you end up in this amazing industry?
So I am a pharmacist. So I did my 6 years of studies to be a pharmacist. And what really struck me when I started, and this is kind of my inspiration for the work that I'm doing today, is the fact that when I started my studies, I realized that I was doing these studies because I wanted to have an impact on the patient. When you work in healthcare, you try to do good things for the patient, help them overcome their disease or live just a healthier life in general. And when I started my studies, I realized that although that was my vision, the way that people perceived me as a pharmacist was the complete opposite.
Right.
A lot of people think that, the healthcare industry or maybe just the pharma industry is some bad industry that try to, make money behind people's backs and not really care about their health and care more about the financial aspect of it.
Right.
And when people get in this industry, this is not what we're looking for. I mean, of course, it is an industry that makes money like all the businesses, but this is not what makes us wake up in the morning. So I thought, okay, so we have this terrible situation and for now, we don't really have a solution to this,
Mm-hmm.
because we've had this bad image for years and years and years, and no one's found a solution yet. So I thought maybe if I look into new technologies, things that no one has ever looked at before, maybe we can find a solution to this. And I think that new technology have this power of changing mindsets, which is incredible. Changing the way people perceive other industries by maybe creating more trust or more effective processes, or just creating a closer relationship with the patient by eliminating third parties, and by creating this human relationship that you need in healthcare. So this is why I looked into new technologies. And the first one that came to me was blockchain, because I think it was 5 years ago, people were calling it the trust machine.
Yes.
So like, okay, I want to bring trust to pharma industry, and we have this thing called a trust machine. You know, maybe there's a match there. So this is how I started looking into it. And so I worked with my associate. We created this company. And we're like, okay, now let's go. Let's see what we can do with it.
Wow, that's very impressive. And have you had much traction? Have you had lots of companies coming to you and saying, look, you know, we want to speed up our processes and make things faster, more efficient?
Yeah, we had a lot of interest around the technology at the very beginning. And what you need to understand is that healthcare as an industry is still very early stages when it comes to digital.
Right.
So although we have great therapies, we have great drugs and great medical devices, the digital aspect of it is still very, very early. Right. So a lot of pharma companies and just healthcare organizations in general are very interested by blockchain, but they are still in the process of learning about it, of testing ideas and seeing what works, what doesn't work. And one of the problems, if I can call it a problem, of blockchain is that it's really just a small portion of any type of digital solution.
Right.
I don't think that blockchain would revolutionize healthcare in any way. I think it will help make processes maybe more efficient, automated, trustworthy, but it won't change the way patients are treated. So we have to be careful between what we expect and what is the reality of the technical tool, so we don't get overexcited and then disappointed, which is something that tends to happen a lot when we talk about blockchain.
Yeah, that's right. There's a lot of hype around blockchain all the time, and it's going to save, you know, it's going to end world poverty, for example. There's lots of companies always screaming about that, and it's like, we're a blockchain company, we're going to do X, Y, Z. Really interesting insight. I appreciate that. So, what inspires you? Do you have like people that you look up to, and you're like, I want to be like that person? You know, they're really successful. They've made it. Do you have someone like that you aspire to?
I don't have a particular person, but I'm very inspired by all the women that work in tech. So I'll give you an example. I was reading this book about great inventors. One of the examples was Ada Lovelace, I think that's how you spell her name. And she's not very well known, but she's a brilliant woman that lived in the 19th century.
Right.
And back then, she was one of the first computer programmers.
Wow.
She was one of the first to realize that the computers they had back then could not only be used for calculation, but they could be used for a lot of different things. So she created algorithms, which today are just everywhere in computer science.
Exactly, yeah.
Back then, they didn't exist. You use computers to calculate. And she thought, okay, we can use this to do something else. Now, when you think about it, being a woman in tech today is not easy, and we're not a lot of us.
Right.
So being a woman in tech in the 19th century, I mean, it's
interesting, yeah.
a lot harder. You can only
of course.
imagine what was expected from a woman back then. And what she did is just, for me, is so inspiring that you can step out of this image that you need to have that's given to you by society and be brave and curious enough to break all these rules and to set a path for yourself and say, this is what's interesting to me. I don't care if I'm expected to do so and so. I want to do something else, and I'll go for it. And no matter what other people say. And I think this is such an inspiring message.
Amazing. And like having people like that to look up to sort of see what their journey was and how they've done it is always going to be inspiring, not just for young women like yourself, but for everyone in the world, I believe, to go and have a look at, you know, people who've struggled through and made change.
Yeah, I think it's true. And I think you can also be inspired by small features of people that don't really have like this big impact in the world, but that their own ecosystem, in their own city, in their own village, I don't know, at their own scale,
Right.
they have something that makes them different from the rest.
Yeah.
And I think this is what makes things inspiring. This is what makes people inspiring, is that they do something that is not expected from them.
No, I get it. I get it. I think, like, I come from as you know, I work in the marketing industry, and you know, we have lots of inspiration all around us all the time. We've got all these amazing companies that are doing something fantastic and wonderful. They're very sort of creative people, creative minds who've taken something that's perhaps you're already using, already doing, and they change it and they mold it a little bit, and everyone's like, oh, I have to have this. This is amazing. In the healthcare, like, educate me. The healthcare industry to me is very regulated and very, you know, regimented as well. You're always talking about regulation in the markets, about what people can and can't do, how things are running. You know, drugs are being tested left, right, and center. Then there's questions about money. So there's so much regulation and control everywhere. Obviously, you're in the healthcare industry as well. You're also then in the tech industry. I suppose the question that I am coming up to here is that when it comes to creativity, doing something different and something new, do you have that in your organization in 23 Consulting? Do you push people, your team, to be creative and find new innovative ways to do things?
So given the context that we have in healthcare where it's very regulated,
Yeah,
it's a bit of a tricky question. But I think you need to think about it from an outside perspective, from a patient perspective.
okay.
The reason you have regulation in healthcare at the end of the day is to protect the patient. So everything is done to improve patient outcomes and to make sure no one is abusing in any way the patient.
Right.
So the regulation exists for a very good reason. So you need to work in this framework. And there's really no point, I mean, this is my personal opinion, but I don't think there's any point in trying to do things that are outside of the regulation, because this is just how things are working, and regulation is there for a good reason.
Right.
Now, that said, it doesn't mean that we don't have space for creativity in healthcare. We have so much space for creativity, especially with tech. Digital is at such an early stage that can reinvent the world in healthcare with digital, because so little things are done today. So the thing that we have at 23 Consulting, I mean, it's not even a thing. It's just that now that you're asking about it, I'm thinking about it, but
good.
it's written down. It's just, it's just coming to my mind. Is that with my associate, we talk a lot. And we try to not have any type of filter in what we say. So when we sit at a table and we say, okay, how can we make our business evolve? And how do we perceive healthcare in the future?
Right.
We just say whatever comes to our mind. And we really have no type of filter into, okay, is this legal, or can we do this, or is this appropriate, or is there anyone else in the market? We don't really care about this. We just say whatever comes to our mind. And this might sound a bit silly, but this is how we came up a couple of months ago with the idea of putting together a podcast that would highlight the work of female leaders in healthcare. We were just talking, and a friend that's a journalist was here, and we said, okay, there's this new trend about podcasts. There's not a lot of podcasts in healthcare. Maybe we should do something about it. But what's interesting to us, the role of the female leaders. Maybe we should talk. yeah, and we just like building and building and building on these ideas. And at the end, we're like, okay, maybe we should try this. And so we did a market study. We analyzed if it's something that would make sense. What market, who would listen to this podcast, what are the competitors in this market. And once we had that, this is when we sat at the table, and this for real, now we were thinking about it.
Right.
Like, okay, are we going for it or are we not going for it?
So are you going for it?
It's really a process that's like thought through, but this is how we work and we operate.
No,
and
that works.
We
So, I
went
mean,
for it.
the creative side of it, then that it does work for you then, because you've obviously taken something and you've created something out of it. So my question is, where's the podcast?
So it's launching in September. We already recorded this episode with this brilliant lady. And I mean, she's also an inspiration to me because she was saying something that might sound very simple, but it's super powerful. She said, always think about why you do things. And I thought that was very powerful, because if you keep in mind why you do things, you will never lose focus of what you're trying to achieve. And you will always work towards this goal and this dream that you have. And I thought that was very, very important.
Interesting. Very, very powerful. No, I agree. The why is always very important, especially in business, because we always talk about what we do and how we do it. Quite often we don't talk about why we do it. So that's very, very, very good. Do you mind if we talk about you a little bit, rather than the company and the industry and blockchain? So what's your typical day look like as a co-founder of a very successful organization over in Paris, where you're based? What does your day look like?
I don't have a typical day, and I think that this is why I love my job. I don't think I would be able to have the same day over and over again.
Right.
Usually I wake up in the morning, and I don't have that fancy routine of going to sports and meditating, and
okay.
I'm not very good at that, so I'm not going to pretend. I just make breakfast. And then I just either go to meetings or have work to do at the office. It really depends on the day.
Right.
And what I appreciate about the work that I'm doing is that it allows me to interact with so many different people and learn from so many different people, and have all these meaningful interactions with a lot of different, whether it's patients or healthcare professionals. And I feel like it opens your perspective of the world and the industry you're working in. And I think this is really the reason that I wake up in the morning as well, is to get to know all these people and interact with them and never do the same thing. And
excellent.
What I like about the job that I'm doing.
Nice. Variety is good. It's good because everyone always says, hey, I get up and go, I do yoga and then I meditate. You don't do that, but yet you're still being very, very successful. That's really good.
But I can tell that I do some exercise at the end of the day.
I'm sure you do. We all do a little bit of exercise, but then if you're running from meeting to meeting and going to the office and back to a meeting, you're doing lots of movement anyway, so you're good, I think. Well, you mentioned earlier on that a book you read. What's on your reading list these days? What would you say to people, guys, you have to go read these books. They're excellent.
So I read about two different things, and sometimes I read two different books at the same time. I have very bad patience, and I don't like repetitive things, as you can tell. So I can read two books at the same time.
Amazing.
So I read about personal development and technology. This is basically the two topics that I read about. In personal development, I think the last book I read was The 7 Habits of Highly Effective People. I believe this is the title. And one thing that really struck me in the book is, I'm not going to say it exactly as the book said it because I can't remember, but it was something along the lines of, between something that you experience and your reaction, there's a gap.
Right.
And in that gap is your liberty of deciding how you're going to react.
Right.
And I thought that was extremely powerful, that you have the freedom to always decide who you are, how you're going to react, and the outcomes of any type of input that you receive. And I thought that was extremely powerful. I mean, for me, freedom is a value that I think is very important. So that really was very powerful to me.
Have you implemented that concept into your life now?
I'm trying to. I'm working on it.
Good.
I'm working on it, and I think it works beautifully, especially with my associate. When we try to make all type of decisions, I used to react on the spot and not really think about what I'm saying and just go for the first thing that came to my mind. I think a lot of people do that.
Of course, yes.
Instead of listening to the other person, they're just preparing their own response. So now I'm trying to listen and take the time to think about what I heard, if I understood correctly, and then what is going to be my response. And I think it makes such a huge difference.
Amazing. Excellent. I suppose space and taking a step back is always a good thing, right?
Yeah, it is. It is.
Yeah,
it allows you to have more meaningful interactions with the people in front of you than if you focus on yourself and what you're trying to say.
Yeah, yeah. So I always finish with a question about the future and the future generation. Now, the future generation is actually very close to the age that you're anyway. But the people who are, or even the women, the girls that are following in your footsteps at the moment, and they're going to watch this video, hopefully, everyone come and watch this video, and they want to learn about what it means to be successful. How can they, what is it that they need to learn? What was your methodology to get you to this successful point that you're at already in your very young career?
I think there are 2 steps. I mean, if I could find a pattern from what I did. Step 1 is to be curious. Try to step out of the status quo and try to build things on your own without looking at what's expected from you.
Right.
So always think outside of the box and always be curious for other things. And then once you've done that, you need to be humble and accept that other people are smarter than you, and always surround yourself with the people that are smarter than you. Always try to be the dumbest person in the room. And I think that really helps a lot, because those are the people that will help you advance in your career, in your personal life. And if you're lucky to have these people around you, then you know that you can always evolve to be a better version of yourself. And I think you need that humility to accept, although maybe you're successful and what you do is great, there's always someone that can teach you something. You never know everything, and you need to have the humility to listen to other people.
Right. Excellent. Very good. Very, very good. So, Anca, look, thank you so much for your time today. If people want to get in touch with you, how can they find you?
They can find me on Twitter at Anca Petre, or LinkedIn, or Instagram, just everywhere.
Just everywhere. Cool. So what I'll do is I'll take all of those links, guys, and I'll put them into the description below. Definitely get in touch with Anca. She's an amazing person, as you can tell. Anca, thank you so much for your time. It's been a pleasure speaking to you, and hopefully we'll speak again soon.
Thank you so much, Zeeshan.
Take care, Anca. Bye-bye.
Bye.